show you love. Oh no.
Miss Maricor?
Yes.
Ma'am, please come in, ma'am. Okay, so ma'am, hello, good morning. What happened?
Well, I'm not feeling okay, and I wasn't able to go to work because it has been 3 days already, and I want a general checkup to make sure that everything is okay.
So that's all, ma'am?
Yes, that is all.
Okay, so first, we will going to do the first step of the physical examination, okay?
All right.
Okay, so by the way, my name is Sandy and I am the pharmacist on duty today.
All right. Nice to meet you, Ma'am Sandy.
So I'm going to do the inspection of your body features. Inspection is the thorough and inherent visualization of a client or a patient, where I'm going to use my naked eye to observe for any disability or abnormality in your body, okay?
Okay.
So, for example, any presence of masses, tremors for the skin deviation, skin colors, and so the first thing that I'm going to do is I will check your skin color, okay? Okay. Okay, in the skin color, you may have pallor, cyanosis, jaundice, or erythema. But as I can see, you are completely okay.
That's great.
Okay, and next is the skin distribution.
All right.
Okay. Everything is normal, ma'am. So I am now done your body system.
Okay.
I am now done inspecting your body system. Okay. So next I'll do is the palpation of the body system. Palpation is one of the most important part of physical examination, wherein we use our sense of touch in diagnosing illness or disease. So now let's start palpating. Okay, so the head and the neck of the patient. First is palpate head for consistency. Okay, and then next, palpate the temporal artery for tenderness. And then palpate trachea by placing your fingers on each side and feel the tracheal rings. And next is the thyroid gland. So if you found any enlarged thyroid gland, then use a stethoscope to auscultate the bruise. Okay, so let's proceed now to the lymph nodes. First is the preauricular lymph nodes in front of the ears. Alright, and then the post-auricular lymph nodes, which is behind the ears. And then, let's go now to the occipital nodes, the base of the skull. And then, the tonsillar lymph nodes, going to the submental lymph nodes. Okay, so next is the superficial cervical nodes. And then to the posterior cervical nodes. To the deep cervical nodes. And then lastly, the supraclavicular nodes at the clavicle. Okay, so next I'm going to perform the percussion on the abdomen. We perform percussion to determine the difference between dullness of percussion versus resonance and versus high resonance. In assessing the percussion, to determine the size, position, and the density of the abdominal content, I will use my middle finger on my dominant hand to the surface to be percussed, and I will use the tip of my finger as a hammer on the dominant hand. Ma'am, can you please take off your shirt for the procedure?
Sa nail.
Okay, so next I will do auscultation. It is usually done during a physical assessment using a stethoscope to hear the sounds for abnormal and normal heart sounds. Okay, so let's assume that the area of the chest is exposed. First, the suprasternal notch. And below, this is the angle of Lewis. Then, slide your index finger just to the left of the sternum of the client and palpate the second intercostal space. And using the next finger, locate to the third intercostal space. Then, continue palpating until the fifth intercostal space. Move your finger laterally to the mid-clavicular line. Then auscultate the apical pulse using the stethoscope. Then, tap the diaphragm of the stethoscope, then place it to the fifth intercostal space. Then, count the heartbeat for at least 60 seconds. In the regular examination of the body system, we usually use the IPPA, which means inspection, palpation, percussion, and auscultation. While the abdominal examination, we usually use IPPA, which means the inspection, auscultation, percussion, and palpation, because the result may be altered. Abdominal examination begins with inspection. In inspection, abnormalities such as distension, scars, stretch marks, hematomas, and enlarged veins can provide the first evidence for conditions involving the abdomen. In abdominal examination, auscultation of the abdomen should occur before palpation. Otherwise, stimulation of the bowels may trigger a false increase in peristalsis. Bowel sounds are physiologically heard as clicks and gargles in an irregular pattern. Hypoactive or absent sounds can indicate a paralytic ileus, resulting post-operative, or form a condition like peritonitis. Hyperactive sounds may indicate gastrointestinal infection or trying to overcome obstruction. Assessing percussion sounds is helpful in determining the size, position, and density of abdominal contents. Solid organs, fluids, or tumors lead to dull sounds that may sound similar to percussion sounds to the thigh. Palpation should be conducted last. Palpating a normal size liver is sometimes difficult. Liver can only be felt through deep palpation. Start the examination by asking the patient to exhale. Ma'am, could you please inhale and then slowly exhale? Then, as the patient is inhaling, slowly slide your finger towards the right rib cage so they are near to the liver's edge. Then, evaluate consistency, structure, and size. This is all the data that we gathered during the physical examination for you, ma'am. So, ma'am, I don't see any abnormalities on your assessment. So, you can now breathe widely.
Alright, so thank you.
Okay, thank you.
I'll be there whenever you want me. I need somebody who can love me.